Welcome to Everyday Nursing Knowledge Lectures, and today we will learn blood supply to the heart. Like any other organ, heart muscle called myocardium also need oxygenated blood. Even though blood flows through the heart muscle or heart is not receiving that oxygenated blood. So there are arteries called coronary arteries. They originate from the base of the aorta. This is the picture of aorta, and from the base of the aorta you can see two arteries that originating, and it's just above the aortic valve. These two arteries are called coronary arteries, and they supply blood to the heart muscles or myocardium. Now it happens during diastole. That means when heart contracts or when heart pumps, or systole, heart pumps blood to other organs, to systemic circulation, and other organs receive oxygenated blood, whereas that's opposite in case of heart. So heart receive oxygenated blood when heart relaxes or diastole. So when heart relaxes, the aortic valve closes. As a result, blood in the aorta flows through the coronary arteries, and these coronary arteries give oxygenated blood to the heart. So coronary arteries are the arteries that supplies blood to the heart muscle, and it happens during diastole or when heart relaxes. And they originate from the base of the aorta just above aortic valve, from the base of the aorta just above aortic valve. There are two main coronary arteries, that is right coronary artery called RCA, left main coronary artery called LMCA or LCA, left coronary artery. Now the right coronary artery originates from the right side of the aorta and give blood supply to the right side of the heart. Left coronary artery or left main coronary artery originates from the left side of the aorta and give blood supply to the left side of the heart. Now let's see these two coronary artery in detail, its branches and areas supplied by these two arteries. First is left main coronary artery called LMCA or LCA. They originate from the left side of the aorta, and as it goes down, it gives blood supply to the left side of the heart. That is left atrium, left upper chamber, left ventricle, left lower chamber, and anterior interventricular septum. That is septum that divides both ventricles. The septum that divides right ventricle and left ventricle. So blood supply to the left atrium, left ventricle, and anterior interventricular septum, 2/3 of it. Now as it goes down, LCA or LMCA give two main branches, and the two main branches are LAD and circumflex. LAD is called left anterior descending and left circumflex. Now LAD, you can see the LCA, it give branches to circumflex and LAD. LAD goes anterior and towards down, so it give blood supply to the anterior left ventricle, and it goes down, so inferior left ventricle and apex. So LAD gives supply to the anterior, inferior and apex of the left ventricle. So LAD gives major blood supply to the left ventricle. Also, as it goes down, it gives blood supply to the interventricular septum, anterior interventricular septum. So LAD is called anterior interventricular artery. LAD is also called a widowmaker, because if there is a blood clot or plaque obstructing the blood flow through the LAD, the major portion of the left ventricle are deprived or will not get the oxygenated blood. As a result, it increases the risk of death or mortality associated with a heart attack. So LAD is also called a widowmaker. And as LAD goes down, it gives multiple branches. You can see LCA giving branch to LAD, and this is circumflex, and LAD give multiple branches, that is diagonal and septum. Now the another branch of LCA is circumflex artery, and you can see the circumflex goes laterally, and as it goes laterally and back posterior, it gives blood supply to the left atrium and the posterior and lateral part of the left ventricle. So LAD gives blood supply to the anterior inferior portion of left ventricle, apex, anterior interventricular septum, whereas the circumflex artery gives blood supply to the left atrium, the lateral and the posterior portion of the left ventricle. And circumflex give branches to marginal, can see it divides into two, marginal and obtuse marginal. Now let's see the right coronary artery. So the right coronary artery or RCA, it originates from the right side of the aorta, and it gives blood supply to the right side of the heart, that is right atrium, right ventricle, AV node and SA node. These both nodes are the conduction pathway of the heart, and they are located in the right atrium. So RCA give blood supply to right atrium, right ventricle, SA node, AV node, and as you can see in this picture, it goes down and it goes back. So it goes posterior and give blood supply to the interventricular septum. So LAD give blood supply to the anterior interventricular septum, whereas RCA goes back and give blood supply to the posterior interventricular septum. Now as it goes down, RCA gives multiple branches. But the two main branches are PAD and marginal. PAD is posterior descending artery. It is also called posterior interventricular artery because it goes back, it goes posterior and give blood supply to the interventricular septum. So it is also called posterior interventricular artery. So LAD is called anterior interventricular artery, and PAD, posterior descending artery, is also called posterior interventricular artery. It goes back, it goes to posterior and give blood supply to the 1/3 of the interventricular septum. So it goes back and gives blood supply to the right, posterior right ventricle. Now there are multiple branches, but again the second major branch is the marginal artery. This goes, you can see in this picture, RCA, marginal artery. This is PAD, posterior descending artery. It goes back, and this is marginal artery. So this goes anterior and towards the down. So it give blood supply to the anterior and inferior right ventricle. So today we saw blood supply to the heart, which is done by the coronary arteries, and thanks for watching my video.